So I like the crowding cases, by the way. Crowding is your friend. Hello, everybody. I'm happy to share with you my new series of designing attractive faces. The first case will be our patient Ratil. Ratil, she came to my practice suffering from severe crowding. And the treatment of choice for her was extraction before coming to my practice. I will try to help Ratil to avoid extraction, to give her natural healthy smile, to restore the face aesthetics, and not to collapse the facial features. If you check her intraoral photos, you can see with me that she has severe crowding in the outer arch. Even the upper laterals, they are palatally erupted, and you can imagine with me that these laterals, their roots, they are palatal, and that space is only enough for the canines or the laterals. The canines, they are so high, and if you check the bite intraorally, she has a class 2 molar and canine. So if you go back to the textbook of orthodontics by William Prophet, you will see with me that we have two reasons to extract in orthodontics, only two reasons. One of them to avoid proclination in cases of severe crowding, and we have severe crowding. And the other indication is camouflage treatment if you have a class 2 or a class 3, and we have the class 2. So Ratil has the two reasons to extraction in orthodontics, and I will share with you how to use the 4 tools to control that case without any extraction. And of course, she was ready for the treatment. And one of the things that you need to do first is, as we have said, number one is variable torques. So Damon Ultima will come to you as your, let's say, prescription. What are your issues with severe crowding cases? What are the unwanted forces? So again, what are the unwanted forces of crowding cases like Ratil case? So Ultima will come to you as orthodontist. Is this your problem? Okay, I'll give you the treatment of choice, or the prescription, or the medication, or the antidote. So the antidote for that problem, which is the proclination of upper and lower incisors, will be the retrocline torque. So this is your issue. If you have severe crowding, the proclination, and this is the torque prescription by Damon Ultima, which is the retrocline torque to prevent the flaring. So in severe crowding cases, this is my torque selection. It should be retrocline torque for upper lateral to lateral, lower lateral to lateral, and for the upper and lower canines. Most of your class 1 with the crowding cases, you have lingually tilted canines. So once you apply them just by using procline torque, this will give you space. So this is what we have done for Ratil. And she was one of the first cases for me for Damon Ultima. So I did some mistakes for you, so you can learn from my mistakes. So by this, we will shorten the learning curve for all of you, and you can avoid round trips. So I did two mistakes in her case. The first mistake, the torque for the two centers was neutral. It should be retrocline torque. And this is the good thing during the treatment. So one of the things that you will see with me during our 1-year program with Damon Ultima, after the 4th wire, you need to do some sort of revision for your case or detailing session. So in that detailing session, I changed the torque for the two centers to be retrocline torque. The other mistake was the upper canines. As you see with me, we don't have space for the upper canines, and they are totally out of the arch, and they are backally tilted. So in her case, I feel that if I pick procline torque, they will flare more. That's why I picked the neutral torque. But you see with me during the treatment that I changed that because of her smile during the bano reposition or the detailing session. So I went back to procline torque. So again, this is the day of bonding for Ratil. And you know my philosophy to apply very low force level, to think as a cyst, very low force level to the normal force level of the body. So our first wire was 14. I'm trying to open the space for the lingually erupted lower right lateral. I included my canines first. Then 2 visits later, I started to create space for the upper laterals. As you remember, they are palatally erupted. And if you see with me that we are using open coil spring, but with very minimal amount of activation. It's only half a bracket width of activation. We need to apply very low force level during the treatment. Then I did engagement for the laterals using buttons. Still, we are in the first wire in the upper arch, by the way, which is 14 copper nickel titanium, so the force level is very low. Once I have the laterals in the arch, still they are tipped labially. I did some sort of soft tissue contouring to put my brackets in the right position for the laterals. And if you check with me, the torque was retrocline torque for the upper laterals. Remember, what was the position of the root of the laterals? Both of them, they were palatal. So you will see with me during the treatment something I call the gradual torque expression. So if you pick the right torque from the start, while you are increasing the size of your wires, this will give you gradual force level, which is very, very recommended for the periodontal ligament. And now we are in the first Ultima wire, which is 14 by 27.5. We inserted that wire. I will leave that wire for 8 weeks minimum. So for me, the most important wire in my treatment will be the first Ultima wire, which is 14 by 27.5. And I will tell Retil, this is an amazing wire. You will feel some pressure because this wire will do some sort of support for the mid face. So that wire will do some sort of kicking of the buccal segment in such cases to give them support for the mid face in the transverse dimension. And by the way, this is a very good topic to discuss later on, how to express the face attractiveness by focusing on the components of the face, and the most important part is the mid face, the cheekbone. So that wire will help me to give Retil a cheekbone later on. You'll see that in her smiling photographs or the face photographs later on. Then I needed to insert my second Ultima wire, which is 18 by 27.5 copper nickel titanium. Again, I'll keep that wire for 8 weeks. Then she will be ready for something we call a detailing session, as we have said. And in that session, I decided to correct my mistake at the bonding session. So you see with me that I changed the torque on the center to be retrocline torque. And to give her a wider smile, I changed the torque for the upper two canines to be a procline torque. All of that will affect hair bite. Now we are in the intermediate or semi-final cell wires. Now I'm in my finishing cell seal wires, and you remember what was the root position of the upper laterals? They were palatal, but now you can see the shadow of my laterals. So this is the power thing with the gradual torque expression, especially with the Damon Ultima. So the torque expression with the Damon Ultima, it's much better than conventional passive sulfagation. And this is one of the patterns for my finishing elastics. I call it anterior triangle class 2 elastics. You remember the 4 tools to control your cases: variable torques, modified bracket placement, and modified pattern of elastics. And finally, if you need some tads. In Retil case, we didn't need these tads, but for the future cases, you will see with me how to use the tads for your help. Now we are in the finishing stage, and we finished hair case almost in 18 months. All of that using very low force level. So it was simple, safe, efficient treatment. And you see with me the effect of these minor things on the face of Retil. This is the most important view because it's not about I'm not challenging myself or challenging the other orthodontists. It's about using the teeth or the anterior crowding to get some sort of support for the buccal segments. So I need to move the teeth with the bone to support her cheekbone. So the whole idea is how to support the mid-face using the crowding. So I like the crowding cases, by the way. Crowding is your friend. So again, we are creating space for the laterals. If you check the open coil spring, you don't see any compression because, again, you need to think as a cyst, very low force level. And again, the roots, they are palatal. This is our first engagement for the upper laterals, and you can see the root in the palette, it's shadowing. Still we are in the round wires. Then this is my first Ultima wire, my second Ultima wire. So we are improving the control on our teeth. Still we are in the flexible wire in the binary position. Now we are in the semi-SLC wires. By the way, this is one of the good views in which I need from all of you to follow the upper anterior segment. So this is before the torsional expression, and this is after torque expression. Again, this is before torque expression, and this is after the torque expression. So we have more control on the laterals. Now we are in the finishing wire in hair case, and we finished hair case again in 18 months without the need of heavy forces. So we didn't need any bands and expanders. Even we avoided the extraction. And you see with me during the 1 year Damon Ultima program that in order to prevent the flaring of your buccal segment in such cases, you need to pick the right torque for your upper tubes, especially with Damon system. So in summary, we had Ratil with severe crowding, no face aesthetics, no smile aesthetics, with a class 2, and just by taking care of the 4 tools to control your cases, we could achieve that. So this is Ratil before and after. She was so happy about the outcome of the treatment. Her parents, they were happy. And we bonded our fixed retinal on the lower arch. For the upper arch, I'm still waiting the healing of the palatal mucosa. And remember, while you are dealing with your orthodontic cases, you will have some sort of bone remodeling. But the soft tissue remodeling, in some cases like Ratil case, it will take more time. So I'm just waiting the soft tissue recontouring or soft tissue remodeling, the healing. Then I'll put another fixed retainer from canine to canine on the upper arch. You remember her smile. This is her smile at the start of the treatment. Imagine if you extract in such case. Of course, you will collapse the facial features, but because we avoided the extraction, this is her smile at the end of the treatment. I think if I give ID for Ratil after and another ID for Ratil before, they will not be the same person. They will not believe that for that face, this is the old ID. So all that change in her cheekbone, the jawline, and the smile aesthetics, all of that was done just by simple tips. And if you want to learn these simple steps or tips or tools, and you can offer them for your patients to differentiate your practice or yourself, doors are open, okay? I hope that you enjoyed what we have presented for you in terms of severe crowding cases, how to avoid extraction by simple steps. And all of that will be available to you if you are going to join us. By the way, we have a catch-up module for season 2 that will start in January 2025. And this is the last chance to register. So don't wait. You need to take decision in life. So one of the good decisions is to have the right education program with the best technology ever in the market, okay? So wish you all the best and keep the good work. Thank you so much.